A new CDC report out today estimates that autism diagnoses are increasing in the U.S. In 2020. 1 in 36 children were diagnosed with the spectrum disorder. The CDC says in 2022, 1 in 31 children were diagnosed. ABC's Rena Roy has more on why experts believe we're seeing that increase.
A new CDC report estimating an increase in autism cases amongst American children. The report says 1 in 31 children under the age of 8 were diagnosed to be on the spectrum in 2022 compared to 1 in 36 in 2020.
We're likely seeing this increase because of a combination of factors: increased awareness and increased intervention. Also, the definition of autism has greatly been broadened. So as the definition broadens, we will likely see a rise in that number.
The data comes from medical institutions across 14 states and Puerto Rico. Not all of the children diagnosed are living with the most severe forms of autism. In this report, less than 40% were classified as having an intellectual disability. Health and Human Services Secretary RFK Jr. addressing these new numbers today.
And this is just one disease. This whole generation of kids is damaged by chronic disease.
RFK Jr. often speaks about rising autism rates, recently facing criticism for consistently omitting crucial context and suggesting vaccines are to blame. Just last week, he promised much more work will be done by the fall.
By September, we will know what has caused the autism epidemic, and we'll be able to eliminate those exposures.
But experts say that's not realistic.
It feels improbable that any group of individuals could get together and find a definitive cause of autism in about 5 months. But one thing that is pretty clear is that vaccines do not increase the risk of autism.
Now, scientists have been studying autism for decades and say it's likely caused by a variety of factors, including genetics. Some experts say it's possible something else might be contributing to the rising rates, including environmental causes. Rena Roy, ABC News, New York.